I'm Shankar Rai. I'm a plastic surgeon by training. I am one of the 13 reconstructive surgeons working in the Department of Burns, Plastic and Reconstructive Surgery of this Kirtipur hospital. We have to train a lot of our people, both the residents as well as the faculty in the field of cleft and craniofacial deformities. And we have a lot of challenges in providing the service, but we have been very lucky that there are few organizations which are helping us in the provision of the service. But the collaboration with the cleft is going to focus more on education of our team so that we can provide a better service to our poor people.
So I'm David Sainsbury. I'm a cleft and plastic surgeon in Newcastle upon Tyne. The Cleft Charity have come to Nepal to visit the cleft team here in Kathmandu. The ethos of the Cleft Charity is different to many other cleft-related charities in that we would like to be invited by the host team. We go on their terms and we try to be mutually collaborative to improve the standard of cleft care. So it's great to be here, and I hope that we can find ways that we can help here in Nepal.
Our hospital is like 100-bedded hospital. Patients are from different background. Some of them are from very remote rural area. When it started cleft program, the cleft patient used to be like elder patient, because at that time there was very few surgeons and they have to depend on the visiting surgeon. And when our program was started, there was lots of backlog. So we started in 1999, more than 20 years. So now we see usually young children. So means we are creating awareness, I think. But still, some patients who are in the very remote or rural area, or those patients who have only cleft palate, they come late because it's not seen from outside.
In our center, we do cleft lip palate parents counseling, and then we do cleft lip palate and bone contracture surgeries in our center, and we provide speech therapy in our center, as well as we do orthodontic treatment, dental treatment.
The thing that I've been trying to get across and that I'm really excited by is that psychological well-being is something that everybody in the team is delivering, the whole team. Everybody's job is aiming to improve an aspect of somebody's life that's been affected by cleft. And all of our roles are improving somebody's physical well-being, hopefully, but having a psychological impact. And so in today's session with the nurses here, that's what I was talking to them about the idea of them having an important role psychologically as well as in all the practical tasks that they do.
The nurses in Nepal have a much harder job. There are quite a few members of the multidisciplinary team. They do all the dental, they do the psychological aspect, as well as the nursing role, as well as the speech and language therapy.
For the last few days, I've been working with your speech therapy assistants here. We've seen some of the patients and we've done some assessments together, and then talked to the rest of the team about what interventions might be beneficial for that patient. But then also, once the patient's gone, we as a speech therapy team have talked about the types of difficulties that the patient has and things we might be able to do to improve the quality of their speech.
I really want to thank to the team who come from the UK, because this time we have chance to learn many more things. Like we have been learning speech therapy since so many years, but this time we got the specialized nurse. She teaches so many new things, and she empowered nurses as well. And the another new thing is we have not been exposed to the psychology class. That is really good thing, and all of my girls are really excited.
I have been stressing how hard it is to the sisters here who go out into the communities, looking at the psychological effects of the parents. There isn't a lot of psychological support here in Nepal, and it is just telling the nurses how important it is to acknowledge the feelings of these parents at birth. and normalising the cleft.
I hope that one day our poor people from Nepal would have the same access to reconstructive surgical care like anybody else in the whole world. I hope that we as medical team members would be able to have the same knowledge and skill that every other person has in the other parts of the world. I hope that our facilities, medical facilities, would have the same kind of standard of care to our people one day.